Hello, I'm Charles Mallet with a UK column interview, and today I'm joined by Dr. Liz Evans, who is a former NHS doctor, a practitioner of complementary medicine, and the co-founder and chief executive of the UK Medical Freedom Alliance, which deals with the increasingly murky area of medical ethics. Liz, you're very welcome, and thank you very much indeed for joining me.
Yeah, thanks so much for having me on. It's been great to get to know you guys a bit since the Heritage Party conference.
Indeed, and that what you spoke about then will absolutely be something that we come back to
Mhm.
later on. I think what I'd like to do is just set the scene for the audience in terms of how you've got to where you have got. There are an amazing array of things that you are involved in and things that we will struggle to fit in the time to talk about. But let's go back to the beginning and explain to me, please, what it is that drew you towards medicine of any kind in the first place.
I was a very high achiever at school, particularly in sciences and maths. And I think actually it was interesting. It was some sort of children's fly on the wall documentary that went on for a week when I was about 13 in A&E, watching people in A&E. And from that moment on, I was like, I want to be a doctor. That just looks amazing. I think I've always been, I love people. I want to help people, which was the one thing you were told not to say in your interview for medical school. You don't want to do it because you want to help people, but actually, doctors who decent doctors, that will be their motivation. But also, I was fascinated by physiology, biochemistry. I loved medicine. So, yeah, I was delighted to get a place in medical school and was a very sort of high flying conventional doctor, a real sort of normie. And planning this career, wanted to do obs and gynae, loved being with my patients. I loved hospitals. Whenever I went into a hospital, I always felt at home. I can't say the same now. Life was good, and I was just in on that sort of track to sort of. I saw my future as a consultant, but then things changed.
Indeed, they did, and we will get to that in a second. Just to take you back to the advice you received to say, or rather to not say, that you wanted to help people. Why? Can you just go into that a little bit more? Why were you instructed not to say that? What is it that's wrong with saying that?
It was considered to be quite trite, I think. So when you were being coached for interviews for medical school, you were expected to produce a lot of work experience. So I'd worked in a blood transfusion lab, I'd worked in a sort of hospice and a rehab center. And you were expected to have a passion for the sciences. So there was, it's really interesting. And obviously they do pick these sort of high flyers who are able to take on a vast quantity of knowledge and and produce amazing exam results. And now looking back, I realized that in medical school we were not taught to critically think, because actually it was just such a vast quantity of stuff we had to learn, that you took as read what you were told. So for example, when we learnt about the vaccines, the vaccine schedule, we were taught the schedule, we were taught the ingredients, what each ingredient did. But no one would have ever said, oh, aluminium, is that a good idea? What's the side effect of that? Or, oh, formaldehyde, that's a bit poisonous, why? There was no asking why. So I think we became very good at detecting, but being a bit of a detective to sort of put patterns together of symptoms and signs to come to a diagnosis. And then we'd learned, all the pharmacology and, what to do beyond that. But we weren't taught to question any of it. It was kind of handed down. And I think by the time you got out of med school, there was an unspoken assumption that you had been taught everything that needed to be known about health. So on my sort of later journey, when I started to, having to engage with things like acupuncture, homeopathy, due to a health crisis myself, and Western medicine having no answer, it was very strange, because when it started to work, I was like, well, we weren't taught this at medical school. And it wasn't like we were taught that acupuncture doesn't work or homeopathy is nonsense. We were taught nothing. So then there was the assumption, well, if it worked, we would have been taught it. So we've been told the whole truth. I think that's the kind of indoctrination that you come out with, and it's very subconscious, so you don't realize it until maybe your life kind of turns upside down and you start to see things which you just would never have known.
I think that's a great insight and will give people who haven't lived in that world at all a much better idea of why it is that the allopathic medical tradition seems to be so rigidly adhered to certain points of view. Just on that, because you trained both at Cambridge and Imperial, I suppose this could be a question that brings hindsight to bear, but did you have a sense of where the people around you were going to end up going?
I mean, certainly, obviously, to get a place at Cambridge was very sought after. A lot of the people who I went to a reunion recently, and some of the people I met, they've all become high flying consultants. Some of them will have gone into academia. Going then to sort of a prestigious London medical school for my clinical. So that was St Mary's. People wanted the academic jobs. They wanted the status, the kudos that brings. And actually, I think when I first applied for jobs and I'd been doing very well and getting high grades, I realized that the teaching hospital job was available to me. But I suddenly thought, I don't want to live my life like that because you're often working for really brutal consultants. You had much worse on calls. It was not a particularly nice environment. But I think anyone who wants to go far in medicine, especially on the kind of professorial route, the teaching hospital route, is pretty brutal. It's a bit like the army. You have your humanity kind of knocked out of you through, being perhaps slightly bullied, doing very horrible hours, having to sacrifice, sleep. Whereas the job, so I decided at that point, yes, I could get a teaching hospital job, but actually I'm going to get a job in a DGH, District General, where it's just a 1 in 5 on call and where it's a lovely consultant. The team's really nice. It's not high pressure. It's not kind of, I realized that I had to create the life I wanted, not try to live a life that other people would think was really admirable.
Yeah, I think that's really very well put. And again, without experience of what it is that you're describing, it is very hard to tell, but it does give a terrific insight. Now, from the outside, it has looked as though the NHS has been undergoing a period of managed destruction.
Mhm.
What was your sense of the way in which you or those around you were managed, and how did that change during that period?
So I, because of health issues, only really worked in the NHS for 6 years, and this was in the 1990s. And it was just at the time when evidence-based medicine was coming in. So this was a big buzzword as I kind of finished my clinical and started my jobs. But I think at that point, doctors were able to use their clinical experience and wisdom and sort of intuition to innovate with individual patients. So there was still very much patient-centered medicine, and evidence-based medicine was a guideline or a kind of something to refer to so that you could get the best evidence, but it didn't necessarily completely control what you were doing. But I think that was the beginning of the destruction of patient-centered medicine. And now, I look at what's going on, and there is no real doctor-patient relationship anymore for many reasons. You don't have your own nominated GP. When I was doing general practice, sort of registrar jobs, which is the sort of trainee general practice jobs, there was still, you did have your family doctor. Your doctor would see you and actually, examine you, talk to you. They knew your circumstances. So that's changed massively in 30 years. But these guidelines, which started to come in 30, 40 years ago, have now become protocols, algorithms that the doctor almost reaches for unthinkingly, and they daren't stray outside. So it's deprofessionalized the practice of medicine. It's like they're no longer autonomous professionals who can act in the way they see best for their individual patient. I think you have to be quite a maverick these days to be prepared to do that, because you feel you've lost your protection. If something goes wrong, then you're going to be punished. But if something goes wrong and you followed a protocol, well, that's not your fault. So it's led to a very defensive practice of medicine, but I don't think that's serving patients, because obviously all protocols are one size fits all. And that sort of denies the unique, humanity of each of us and our unique circumstances, our different physical, emotional, psychological, spiritual circumstances and needs and desires. And it dataizes people somewhat.
I think that's very well put. And I think also you could apply that to an awful lot, if not all, industries, the way that discernment has been replaced by a sort of automaton-like reaction to a process. And that brings me towards your next step, which was to move away from the NHS. But before we do that, I just want to understand your view of the relationship between the NHS, either as it was then or as it is now, and the pharmaceutical industry, and what the role of a doctor is in that process.
So I think it's very obvious that the healthcare industry across the world has been hijacked, or it's become an industry and it's been hijacked by pharma as a great business model for rolling out, almost guaranteed amounts of their drugs. And the taxpayers in this country and the insurance companies in America fund that. So basically, we are kind of, it's our money that's being funneled through the way the system is set up. Back in my day, definitely drug companies were doing a lot more overt sponsorship of events, and doctors got a lot more freebies in those days. So I think that's been kind of curtailed. People are more aware of that now, but I think it's a more insidious influence of the pharmaceutical industry now, because they are actually driving. Now these protocols are running everything. Once a doctor has diagnosed hypertension, say, for example, they reach for their protocol, and it is literally drug, drug, drug. Yes, you might sort of say, oh, well, you could go and do a bit of exercise, but that would only be an add-on. That wouldn't be, let's try this before we try the drug, unless the patient's particularly, minded not to take medication. So, so I think and of course, academia, the journals, the journal articles, everything is kind of been designed, and the system is now in a way that the pharma industry has a tentacle in every single area of what brings medicine to the individual patient. So the idea that the randomized control trial is the gold standard of evidence-based medicine. Now, I remember being taught that 30 years ago, and it was a real mantra. And and it kind of makes sense. But then you think, well, hang on a minute. A randomized control trial only is going to work for a drug. So in a sense, you're then saying the only evidence you've got to look at is something which is going to be produced by pharma, which is going to come out with an outcome that suggests that a drug is the answer. So it's quite clever, because of course with lifestyle interventions or dietary things, whatever it is, you can't really have a randomized control trial. But then in the doctor's mind, they'll think, well, we haven't got the gold standard, so actually we're better off to put them on this statin or whatever it may be, or Ozempic or whatever it is these days. So I think it's now very cleverly set up to be a very, very lucrative business model for pharma. And of course, any complementary medicine has been sidelined far more than it used to be. I mean, it's it was always this idea of quackery, but we had a Royal Homeopathic Hospital. The GP that was my GP trainer, he did homeopathy. But those sort of things have been very much demonized now and discarded.
Yeah, I think that's the impression one gets, as I say, from the outside. But I'd love to know about your sort of personal journey towards that area. I mean, you talk about a health issue of your own. I'm not asking necessarily for details of that, but how did you make that transition from being very much set within the system that you describe, especially with the academic background and your your sort of great drive to go in a particular direction, and then the move towards something completely different. Well, certainly notably different.
Yeah, I mean, I'm really happy to share the health crisis because it is quite relevant. So I was so indoctrinated in the system that one day I was an SHO in A&E and we had a quiet day. And that's really unusual. So I was sitting around at the nurses' station and occupational health wandered through, basically saying, does anyone want a flu vaccine? I mean, now I look back and think, oh my gosh, that's so inappropriate. Like, we weren't even sent a letter saying, if you want one, you can come to, literally wandering through. And I was just like, yeah, why not? I've got nothing else to do. There's no patients to see. I'll just, rolled up my arm there and then in A&E, just, in at the nurse's station, I think, as far as I remember, not in a private room, just got, injected. And I think also my indoctrination, I kind of collected vaccines like stamps. There was this real thing, wasn't there? It's like, oh, I'm going abroad. I can have typhoid and I, can have all these exciting ones that I've not had before. So there was this sort of sense that this was a little badge to have. So I didn't give it any more thought. But actually within sort of 24, 48 hours, I was not feeling great. And it was just before Christmas. And then I had 10 days off. And during that period, I got worse and worse. I managed to go back after 10 days, but after a couple of days, I was literally floored. And within a week or so, was bedbound. And I basically developed chronic fatigue syndrome. It transpired, so full on, adrenal fatigue, ME, whatever you want to call it. And that vaccine was definitely the final straw. I think probably working in A&E, doing shifts, changing my sleep patterns, I'd had a throat infection a month before, I'd taken antibiotics. So lots of things had led to the point where my health was in a critical point, but that was the final straw. So I ended up with 2 years off work, basically completely unable to work. But the joy or the blessing of being a medic was I knew that Western medicine couldn't help me, and I wasn't prepared that my life was over. I was like, all my friends, I was mid-20s, all my friends were, going on in their careers, getting married, having an amazing social life. And I was basically stuck on a sofa or in bed and, not able to live a normal life, not able to earn money, thinking, well, I'm never going to be able to have children at this rate because I wouldn't be able to look after them. So it was my dad actually who said, well, why don't you try some acupuncture? And I wouldn't even have known about any other modality apart from Western medicine. But I thought, well, why not? I've not nothing else to do. So that was my sort of toe into this sort of whole nother world of holistic complementary medicine, which instead of saying, what's your illness and what do we treat it with, just looked at your body and tried to optimize it. So over several months, I sort of went to a nutritionist, I did some osteopathy, all sorts of things, changed my diet and kind of worked out, okay, I've got to help my body to heal. So I need to give it the best ingredients, take away all the things that are causing it stress. So, environmental toxins or whatever else it may be. I give it the best environment, the best rest. And gradually my body started to heal. And I was like, wow, well, this is really exciting. I was not taught this at medical school because I thought if there wasn't a drug, then you were just on your own and it was luck, because that's basically what my GP had said. He says, well, go home and rest. You might get better, you might not. And so when I did finally go back to medicine, I changed my career path because I realized obs and gynae was, going to be really intense, lots of night shifts. That was never going to be open to me again, really. So I went back to GP practice and we had to do presentations for for all the trainees. So I did a presentation on how I'd recovered, like how exciting it was and, and what I was really shocked about is that nurses were quite interested. Doctors were not interested. They just could only see things in one paradigm. And so at that point, I realized that actually medicine was not going to be for me long term because I'd had this massive paradigm shift and I wanted to help people to work with their bodies to heal and repair rather than just suppressing symptoms. And, by this stage, following more protocols, someone comes in with eczema, you put them on steroids and this and that. But actually, I realized that there was a huge amount you could do with diet, supplements, and just changing their internal sort of body, and optimizing the conditions that they can tap into their own healing and repair.
What an astounding journey. And thank goodness, of course, that the situation was resolved in the way that it was for you, and that you were so determined to, to make it better and find that resolution. Going back to when you first became ill and when you would have been looked at sort of in the first instance, was that within the context of you being certain that it was the flu jab that had set this off?
I mean, I had lots of blood tests and ECGs and all sorts of things, which basically don't show anything when you've got chronic fatigue, and this is the issue. But I knew, because the symptom that developed within 24 hours, suddenly my glands came right up in my neck. That did not go away completely for 4 years at any point. And it was always the thing, even when I went back to work and I was sort of 95% better, if I overdid it, that would happen again. I mean, that's now not an issue at all. So that's good. But yeah, in my mind, there was no doubt. And actually, I did go to a chronic fatigue consultant, and one of his advice things on his sheet was that you shouldn't have vaccines once you've got chronic fatigue, which was really actually quite big, because I think that certainly would not be the advice given these days. They probably tell you to have more because you're vulnerable. So I don't think I ever really brought it up with the doctors particularly, but it was a light bulb moment for me. And then I just thought maybe I was unlucky. But then I started, when I got a bit better, to read around, and I was shocked to find that there were all these side effects from vaccines. Again, stuff in peer-reviewed literature published that shows that, this was not a one-off. I wasn't the only person, that people can have very serious side effects. So again, that was a whole nother rabbit hole that kind of I stumbled down. But I think stood me in good stead for what I've ended up doing, because I think the important thing about that is you realize how important informed consent is, because it doesn't even matter if that's only a 1 in a million. If that happens to you, it happens 100%. And nobody is going to come in and pick up the pieces, pay your bills, pay for you, all of your treatments to help you get better. So actually, that sense of just being quite blasé with medications, which I think a lot of doctors are, I certainly was. I remember being on the wards, and if you had a bit of a sore throat or thought you had a bit of a urinary infection, you'd just go to the nurse's station and say, "Oh, can I just have 3 grams of amoxil?" Or me just rolling up my sleeve while I'm just sitting in public going, "Yeah, give me a vaccine." That's kind of, we were very, very blasé about these things. We just thought that they were, all good.
Yeah, I mean, I think that will be something that resonates with anybody who's had any interaction with people who still are within the confines of the National Health Service, and it's exactly how I think people do perceive it, whether they think it's right or not. Now, to go on to your sort of complementary journey yourself, rather than being as a patient, but as a practitioner, how did that go, and how did that sort of lead you into 2020?
After I'd gone back to medicine for a couple of years, I then got pregnant with my first child. I've had 4 children, and I wanted to be a full-time mum. So that kind of took out the next 10 years of my life, having babies and sort of, bringing them up very healthily. So I was very careful about my diet. I was very careful about their diets, keeping them away from doctors, using complementary medicine, homeopathy, osteopathy, to deal with issues for them. And I joined the BSEM, which is a British Society of Ecological Medicine, which are doctors who train in nutritional, environmental, allergy medicine. And I went to lots of their modules while I was being a full-time mum. So did quite a lot of training and finding out more about this. And I would recommend anyone who wants to deal with a health issue on a more functional basis, look up the BSEM and there's a list of doctors who are all fully qualified doctors. A lot of them do still work in the NHS, but they practice privately using functional medicine techniques, and it is brilliant. So I knew that once, my kids were old enough, I wanted to retrain in something. So I've ended up retraining in something called NAET, which is it's Nambudripad's allergy elimination technique, which uses kinesiology and acupressure to it works on a sort of Chinese meridian energy level, to help people's bodies to rebalance and, clear blockages, trauma, whatever. And I use that in conjunction with nutritional medicine, which obviously I did a lot of modules with the BSEM. So and I do a lot of talking. Actually, I think, I see my patients for an hour at a time. And I think the root of a lot of issues is also emotional. So, whatever the disease, there's always an emotional component. And I think just talking and being with people and trying to get to what the root cause is really empowering for the patient. So they start to see how, and I never say to them, I'm going to it's me healing you or curing you. I'm helping your body to heal itself. And that's the the different perspective, I think, that you have in complementary medicine. And it's really exciting. And I would never go back to medicine, although I'm so glad I did it. I'm glad I have that knowledge, because I'm able to sometimes say to my patients, actually, you need to go to your GP, you need to get some blood tests, I'm worried you've got this, or you need to have this ruled out. So it's great to have that background and foundation, but then to be able to build on it and actually use it for a different purpose.
Absolutely. And then to sort of bring us up into the modern era, with that being your standpoint, both sort of personally and professionally, what was your view if you cast your mind back to just over 5 years ago, when we were being told that something that had possibly come from China was going to create death and destruction all over the United Kingdom, and this is going to be the response? What were your first thoughts for either those people that you were dealing with already, or for the population at large?
So being a medic, I think I accepted the possibility we could have a pandemic, because, I'd been taught that we'd had these pandemics in history. So that wasn't too hard a thing to imagine, but I very much felt confident that however bad it was, we'd be fine. And I remember in sort of February, March, when the fear was really ramping up, I actually said to my children, don't buy into the fear. You really don't need to worry about this virus. Yeah, we'll probably get it, but I've got all the vitamins in the cupboard, and we know how to treat illness and to support the body so that it gets through things. So I'd very much moved into this idea that it's not the germ, it's the soil. It's actually, if our bodies are healthy and our immune systems are strong, we have nothing to fear from infectious disease. So, and I think that in hindsight, that was really helpful, because I think not buying into the fear meant that I could keep a really clear mind and see things far more objectively than if you're fearing for your own, your own life or the life of your children.
And professionally, well, I suppose actually all personally, how did that go down with the people that you were in touch with on a regular basis? Did you find that you were sort of well out of kilter with other people, or were there many sharing that sort of sense of perspective?
I mean, obviously, I had a sort of a network of people who practice complementary medicine. And so in those groups, yeah, I think all of us were pretty confident that it would be not an issue for us, but we did buy into the idea that it could be a big issue for other people, but that we felt that we would be able to treat it. So as a result of my sort of confidence about it, I very quickly signed up to get my license back to go and help out in the hospitals. Because I was like, well, I might as well go and help, because I'm really not scared of this, because, I'm sure I'll get it and it's not a big deal. So yeah, so I ended up going through that process of, I was like, I can't believe that they would want me back, but, I'm sure I can still take blood, and I can do a full history and examination and do the basics. And I could be a help in these overcrowded, chaotic hospitals. But of course, and now I realize, I went through the process and I spoke to them, and they were like, yeah, we'll get back to you if we need you. And guess when they got back to me? They got back to me at the point when they were looking for vaccinators. And then you think, oh, wow, that's what that was all about. Because I think very few people were drafted in to help out with the efforts fighting COVID, but they had I think they had nearly 1 million people sign up, or lots and lots of people who offered to go back and come out of retirement or whatever. So
Yeah.
at that point I said, no, please don't contact me again. I'm not helping out with that.
That is extraordinary. But as you say, that was the main effort. That was the push, was to create the conditions for people to accept a product that was in its trial phases. And it's when you explain it like that, it really couldn't be more clear. Also, again, it confirms the belief, I would say, that a lot of people listening to this, I'm sure, hold that certainly hospitals were not inundated. The medical system was not drowning in patients, as was widely reported in the mainstream during that period.
I visited a hospital about 4 weeks into lockdown, the first lockdown, when you remember I was in my home, I did my one walk a day, we were, doing stuff in the garden, so it was, I was being very obedient to the rules, but then a neighbour died of, well, now I realise nominally COVID, but actually it was the ventilator. He was put on a ventilator. He walked into hospital. He was on a ventilator for 16 days and then they turned it off. And his wife of 50 years never saw him again from the moment he walked out of the house. And she sat there for 16 days alone in her house. None of her family would visit because it was against the rules. And then they phoned her to say, we're turning it off. And then she never got to say goodbye. I mean, and actually that was the point at which I started to think, this is wrong. What is going on? Like, that's not how we practiced medicine. Back in the day, we didn't like we wouldn't separate people from their loved ones. What? So that was when my red flags and bells started going off. And I went in for her because I said, what can I do? And she said, could you go and collect his stuff? So that was my first sort of outing in the car. Went to the hospital, deserted roads, arrive at this hospital where I used to work, which is always impossible to find a parking place. It's heaving. And it was like the Marie Celeste. And I was like, oh, this is weird. This is not what I was expecting. Went to the main entrance, totally deserted, nobody in sight. And I was thinking, well, that's also really weird. And then the nurse came out and I said, oh, I'm here to collect these effects. And I said, how are you? It must be awful in there. Are you coping? And there was something about her response that was so off. Like it felt incongruous. She kind of looked really awkward, looked away and just went, yeah. And that's not a normal, because you would have thought in that situation, if it was awful inside, she would have been like, yeah, it's horrific. It's like a war zone, thank you for picking this up. I need to get back. But it wasn't like that. And I knew this person. So at that point, I realized there was something really, really off about the whole situation, that we weren't being told the truth. And there was something very wrong.
Yeah, there absolutely was. And I would, lay down a challenge for anybody to come forward and say that they found anything different in a hospital if they went into one. I remember having to go into one for a broken bone episode. There was no one there. It was completely extraordinary. Now, what you've described with the lady whose husband died and was put on the ventilator is absolutely horrific, but it does lead us directly into the area of medical ethics and therefore the establishment of the UK Medical Freedom Alliance. Please, I mean, I know the area of medical ethics is obviously enormous, but sort of in a nutshell version, what stimulated the progression and the development of that as an idea?
So following this episode with my neighbor and feeling, I was outraged. I mean, I was so outraged on her behalf. I was devastated for her. Like, how can this be happening? And she, could only have 3 people at the funeral. I mean, it was just so wrong. And that was when it really came to me. It's like, there are red lines that you don't cross no matter what, in countries which have Ebola, which obviously has a huge death rate. You would not stop a mother cuddling their dying child or a husband holding his dying wife's hand. So it's like, it's not a case of, well, in some circumstances we can act inhumanely. I think actually there are red lines which you don't cross, and people can make their own judgment as to whether they, and I think 90% of people would put their own sort of fear of a disease aside to be with the one that they love. Because, there are some things worse in life than death. And I think that's really came home to me. And then I was following all the stats with a growing horror because I was realizing more and more we were being lied to. But it was the day in the summer when all the cases were down to zero, all the deaths were down to zero, because I was following it very closely and it was being reported in the press. We're pretty much nothing's going on at the moment. Then they brought in the mandatory masks in shops, and I cry. That was a real sense, sort of a discernment, a spiritual sort of darkness just hit me. And I was like, I remember crying for like a day and then saying to my husband, we're in real trouble. Like, this is going to vaccine mandates and vaccine passports. And, at the time we didn't even have vaccines, but I just knew it because I could see that if you introduce a measure which is so kind of oppressive at that point, when things are as good as they can be, then where does it stop? Because how do you get better than zero? So then I realized we were in big trouble. And so over that summer, I went to some protests and just was thinking, what am I going to do? And I thought, well, if we're going to have vaccine mandates, we need to have a medical freedom movement. We don't have one. And no one else seemed to be about to form one. Molly had done a great job starting Us for Them, and they were campaigning for children. And my husband was like, are you going to join them? And I said, well, I don't know. No, I think we need to start a medical freedom movement like the ones in the US, which were very well established. So I put out a call on Facebook in, I think, September, and was inundated with doctors, nurses, other healthcare professionals, scientists, academics. And we had an illegal meeting in October of about 40 or 50 of us to get a plan together, and just sort of it went from there. And then immediately they'd announced that they were going to try and roll out the vaccine before Christmas, which is not what we were expecting. I thought we had a bit more time, and I was going to sort of warm up by challenging mask mandates and challenging testing mandates and all these other things which were infringing on medical ethics. And I was a bit gutted that the first thing we were going to have to do was get our ducks in a row about the vaccines, because at that point it really was not cool to be an anti-vaxxer. Even people who were questioning lockdowns were in the main not questioning the vaccines. And so we managed to get together a 14-page fully referenced letter. Before they authorised them, we sent it at the end of November 2020 to Matt Hancock, JCVI and MHRA, begging them not to go ahead with the authorisation, and going through the ethical reasons, the lack of a public health emergency at that point. All the data was in on COVID, and it was a very low death rate, IFR. Also, the known risks of the vaccine, which had come out in the trials, the unknown risks, the lack of any long-term safety data, and also the environment within which it was being reported in the media, which meant it was going to be highly coercive, and actually we're not going to be able to get informed consent. And I'm really pleased we got that in and it's on the record and it's dated, and it shows how much evidence and arguments there were at the time that this was going to be a terrible idea. And many of our predictions in that letter, sadly, have become reality. So it was available for anyone to see this. This was not classified data. We were just a team of like volunteers, kind of trawling everything and reading stuff and putting it all together. And so that's where we started. That was our first letter.
What, if any, response was there to
None.
that letter? Really, still none.
Still none to that letter. We've sent over 60 open letters to various, ministers, regulators, public health bodies, royal colleges, doctors, all sorts of people over the last 5 years. We have engaged in some back and forth with the MHRA. There's a series of letters, but not much response, frankly. But I still think that it is our paper trail of accountability. It is on the record. One day, I really hope it will be, used to help to hold people to account.
Yeah, and I think that's it. That's in a way, the other side to the informed consent coin, but it's never considered is the issue of liability. I mean, with regard to, let's say, the vaccines, okay, in the first instance, the extraordinary, well, apparently extraordinary decision by the government to provide indemnity for any vaccine manufacturer, but then no liability either for the individuals that were conducting the vaccination of people who were turning up and receiving this product without, as you say, informed consent.
Yeah, and we wrote an open letter to vaccinators, which we encouraged our supporters. So we published it, encouraged them to post it to their local GP vaccine centre, to give it to people, to basically say, this is what the law is around informed consent. This is what is known about these vaccines. This is the information you must be giving to people in order that they can give informed consent, because otherwise, you're not following the law. So yeah, I mean, we did lots and the whole list, I did it in a slide for the People's Vaccine Inquiry press conference recently, a list of all the things which should have been told to people, disclosed, like the fact that it was under temporary use authorization, the fact that there was only like 2 months of safety data, the fact that there was no data on effects on reproductive, function or cancer, or there's the fact that they had immunity from liability. I think that was a really important thing that people should have been told. And actually, we put a quote in our first letter from the AstraZeneca, one of their spokespeople, who was asked by Reuters, I think it was, in the summer of 2020, why are you asking for immunity from liability? And he said, we simply cannot take the risk as a company that in 4 years' time, something becomes apparent, that, some unexpected side effect is apparent. So we need to be covered. And it's like, well, hang on, what the public weren't told that this was even a possibility. And, it must have been a reasonable possibility for them to demand liability, immunity from liability. Why should the public take that risk with their health? And yet, in the end, we ended up with mandates, and 40,000 people having to leave their job as a carer just to avoid having, a vaccine they didn't want or need. I mean, they were trying to give it to people who'd even had COVID. They gave it to pregnant women, they gave it to children, groups which historically in clinical trials and with new products, you don't go near.
Absolutely. And I think all of what you describe would be abhorrent in its own right, even if there had been no adverse consequences for people receiving the product. But of course, sadly, that is absolutely nowhere near the case. And I don't want to pass over things too quickly, but I would like you to talk about the People's Vaccine Inquiry, which of course you've been instrumental in setting up and processing. I know it's not complete, but if you just give a bit of a brief on that as well, and how it links to the way in which this could have all been averted.
Yeah, so obviously we were very interested when the COVID inquiry was announced. We submitted some complaints initially about the terms of reference because they hadn't included medical ethics in it at all. And then we applied for module 1, I think, module 3, and were rejected. We wanted to be core participants. And then we came to module 4 on the vaccines, and we had so much stuff that we had done, over the course of the 4 years. So we put in a really robust application to be core participants. Baroness Hallett came back to us and said, yeah, I can see you have an interest. Could you send me some more stuff? So we sent her some more stuff. And then she came back and said, well, it's, I can see that you do have an interest in this topic, but it is within my discretion to decide who is and isn't a core participant. So I'm not going to allocate you core participant status, but I'm going to ask my solicitors to get in touch with you, and I will request that you put in a witness statement. And that was in, I think, 2023, in sort of September, October. So we were asked to provide this witness statement under Rule 9. So I think that means it is mandatory that you have to provide it. So I spent about 4 or 5 weeks putting together this 50-page witness statement, and submitted it just after Christmas of 2023. And then in the January, they postponed. Do you remember they postponed Module 4 initially indefinitely, and then they said, well, until at least 2025. And it was meant to happen initially before the general election. So well, we were outraged. I mean, I was outraged about that. It's like, I've put masses of work into this. And then I said to them, well, will my witness statement be put on your website? And they said, oh, well, it's at our discretion whose witness statements get put up. And I'm thinking, well, this is not very fair. So yeah, so basically it felt like everything was all of this work we'd done could never see the light of day. And they'd also said we couldn't publish it, or they asked us not to publish it. So at the same time, Hart, so Claire Craig and Dr. Ros Jones and Perseus had also been asked to do witness statements. And so I contacted them and said, well, this is ridiculous. All of this work we've put in, this has to come into the public domain, because this is all about, again, informed consent. Like, this is really important information. This rollout is continuing. They're still giving it to pregnant women. They're still, people are on their 6th, 7th, 8th, whatever dose now. They need to know this information. We can't just let this lie in some government sort of vault. So we decided we would put together a people's vaccine inquiry, and we would top and tail our documents differently. So it's not the same document, but with all of our evidence in. And we met and recorded short 10-minute presentations, each of us, to say, what the key points were in it. Will Jones from the Daily Skeptic interviewed us, and then we put it all on a website so that people could read all the witness statements and also see us presenting, the key points of it. And Doctors for Patients UK also joined in this process, because they are a group of clinicians who are really concerned about what they're seeing on the front line. So they then drafted a witness statement for us, because they hadn't done one for the official inquiry. And Dr. Dean Patterson, the cardiologist, put together a presentation. So we've also got some actual frontline statements, which is really good. So we put that together, and then we've been over to Belfast and did a summit there when there was a vaccine injury meeting in Stormont. And we went to Dublin and did a press conference. And Claire and I just went up to Edinburgh for the Scottish People's COVID inquiry and I presented on the ethics of the COVID vaccine rollout, and she presented on the safety. So yeah, we're basically trying to do the job that Module 4 didn't do, because they eventually did hold the hearings at the beginning of this year, and it's a total whitewash. So they had allowed 3 vaccine injury groups core participant status, so we were pleased with that. That was great. They had 1 KC. They were all brilliant. They did their statements incredibly well, their oral testimony, but they were so limited in what they were allowed to talk about. Hugo Keith was so restrictive and wouldn't allow them to talk about any science, whereas of course they are probably better versed on the science than 99% of doctors in the country, because they've lived it and they've had to read it, and they know their stuff. And just even from the opening statement of Baroness Hallett and Hugo Keith right at the start of the module, they were very much sort of framing it in the sense that the vaccines are a complete success. They've saved millions of lives, obviously. Yes, there has been some side effects, but they are real, but they're rare, extremely rare. And so therefore, we can listen to them, but we're really just interested in working out how we could have done the rollout better. And I think, once you've got the inquiry framed in that way, that they will not interrogate the safety or effectiveness of any of the vaccines, then it's just a box ticking exercise.
It is. I mean, driven by the very industry that's controlling and manufacturing at the same time. I mean, it is, one doesn't want to be pessimistic about it, but it's very, very hard to see how there is a way out of it beyond making people aware to the point where they are able to make a decision that is not going to have a negative impact on their life, but of course set within the context of mainstream media control and the information that will always be put out by government. It's an extremely tall order. Now, just to go on from that, I would like just for a few minutes to go into the area of the way that the health of children has been regarded over the years, and how, you know, very much bears relation to this, specifically with regard to the vaccines, because you have been involved with, you know, advice with regard to COVID vaccines for children. So could you just talk a bit about that, but also, as I'd asked earlier before we started recording, a little bit about the way that you see the direction of travel insofar as the relationship between the NHS and young children?
Yeah, so obviously we haven't just been covering COVID. We're looking at all the areas in which medical ethics are being violated. And one of our big concerns is that there seems to be a massive power grab by the state into the healthcare decisions for children. And I think this is happening in several ways. We're increasingly seeing schools medicalized. So schools are becoming a big setting for public health measures. Obviously with vaccines in particular, and just increasing numbers of vaccines, increasing numbers of visits into school. And, you know, so we argue that that is a really inappropriate place for any medical intervention, because you've got no parents there to advocate for them. You've got peer pressure, you've got pressure from teachers, the child's quite vulnerable. You know, if things go wrong, it's not really a great setting, you know, and you don't it's being given, these public health measures, by individuals who don't know the children. So they don't know their medical histories. So that is worrying, the fact that that's now kind of been established, especially through COVID, when there was all the testing going on in schools. And it was mortifying for children who weren't being tested or weren't wearing masks, or who weren't getting their COVID jab, because it's very public. There's no confidentiality, there's no privacy. You know, you can be publicly shamed by your peers for not following the crowd. So it's a very highly coercive environment. So we're really worried about that. We've also got the NHS, who are, especially through COVID and since, are directing propaganda at children. They were running superhero clinics to encourage 5 to 11-year-olds to want the vaccine, you know, using posters, cartoon characters. We've become aware of a few GP practices who do this every year with flu vaccines. They have sort of party sessions with bouncy castles where the children can come and play and have their flu jab. Now, I just think that is totally inappropriate. It's not a sober, responsible, you know, administration of a medical intervention, which has risks and benefits. It's making such light of something which actually could have profound effects, and it's undermining informed consent. And then we were absolutely horrified to discover at least 2 GP practices sending letters directly to children as young as 10, inviting them to basically be responsible for their own interactions with the GP practice and cutting their parents out. And I'm just going to, I got a couple of letters. So the first one was a letter to a 12-year-old child from a GP surgery, which says, "We are writing to make sure you know that from the age of 13, you are able to take responsibility for your own healthcare decisions, which can include making appointments and seeing a doctor or nurse by yourself. We encourage you to talk through any decisions with a parent or guardian, but we will always try to respect your wishes if you do not wish anyone else to be involved. Confidentiality means your visit to the surgery and anything discussed while you are here will not be shared with anyone else, unless we feel that you or someone else is at risk of serious harm. If you've been sharing a mobile phone number or email address with a parent or guardian, then those details," this is so sinister, "will be removed from your medical record." So then says we need to hold up-to-date contact details for you. So basically say we need your own personal mobile number and your personal email address. Please complete the enclosed personal details form and return it to the surgery. I mean, if any other adult in any other circumstances approached a child like that to say, you can come and meet us alone, we'll make sure your parents don't know, give us your own mobile number, we can contact you direct, we're going to cut your parents out of this. This is huge safeguarding, red flags. And then it says you may wish to have someone else involved in your healthcare, such as a parent or guardian. In order to do this, we need your written consent and contact details for this person so that they can discuss appointments, medical records, medication, and other personal details held by the practice. And then this 12-year-old has to complete another form, a patient consent form, and return it to the surgery. You just think, what planet are these people living on, and how entitled that they feel that they can step into the family and just usurp the role of parents and cut them out of the loop. And then if that wasn't bad enough, we then found there was a group called Unity Health, another GP practice, I think a company who run a few practices, wrote to a 10-year-old saying, we're writing to you as you approach your 11th birthday. This means we need to ensure the contact details on your record are your own. I mean, it's outrageous. And it said, if they belong to your parents or guardian and you wish to update them to your own, get in touch with us via email. So you've got children having like unsupervised private contact with adults they're not related to. There's no accountability, there's no supervision. Or you can come into the surgery or call us. So this 10-year-old might just start wandering off into town 2 miles away on their own. And then, yeah, it says if they belong to your parent or guardian and you wish for them to remain on your record, you need to complete a third-party consent form. So it's an opt-in. That 10-year-old has to actively do something to keep their parents involved. And you can specify which areas of your record you want them to have access to, or for how long you want that access to last. I mean, this is causing a massive area of secrecy, division between parents and children. And children need their parents to advocate for them, to explain things to them. I mean, even a 16-year-old is going to struggle with complex medical decisions. And you can imagine something serious could be going on with your child and you don't even know about it, or they've been put on a medication, or they've been put on the pill or whatever, and you're not even aware, or they've got an eating disorder and you haven't been told. I mean, it's just so horrific. We could not quite believe that this was happening. And if anyone is aware of this happening anywhere else, please can you let us know, because we want to see if this is just a few rogue practices or whether this is starting to become more of a widespread NHS policy.
I should imagine, given what you've said over the last 60 minutes, that it absolutely will be the beginning of something to be rolled out across the country. And as you say, it's incredibly sinister. It's very disturbing. And at face value, it seems that there should be criminal sanctions imposed against such a thing. So I think that needs to be resisted greatly. Now, Liz, we don't want to drive people to despair, because actually what you're doing in all the things that you've talked about during the course of this interview are in fact very positive. And really, who would have thought that what is being described as health could become such a terrifically divisive issue? But how, in this age, in a sort of non-confrontational way, should we be dealing with people that we see are being pulled off in the wrong direction with regards to all the sorts of things that you've been talking about? And what do you find is the best approach to try to make people aware of the very many dangers around them?
So I think what we've done, obviously we've been lobbying a lot, lobbying upwards to policymakers and decision makers, but we recognise that that's unlikely to have a massive impact. And what we want our letters to do is actually to educate and empower individual people, the public, so that they start to understand, what are their rights, what an ethical consultation looks like, and they need to start demanding ethical consultations and informed consent from their medical practitioners. So calling out the individual doctors and nurses when what they're doing is not ethical, because I think, most medical healthcare professionals are, in the profession for the best interests of, they for the best reasons. They're acting in good faith and they want to help people. But while they're being sort of in a system which is starting to completely dismantle medical ethics, I think a lot of them are blind to it. And we almost need to reconnect them to their moral and ethical compass and just call them out when they're coercing people, when they are, for example, doing this with children, and just kind of spell it out to them. So I think this is we're not going to solve this easily. And we do have to keep lobbying, MPs and the MHRA and all these different people. But I think we do also, as the public, need to take responsibility to have adult to adult interactions with the health service, and to call it, when you're in hospital and they say, oh no, you can't visit your loved one, or we're going to put your loved one on a DNAR, or whatever the issues are that you're not comfortable with. We really need to get some courage to just challenge it and just say, no, this is not right. Because a lot of these things are being done, which actually, if you resist it, won't get done. So it's just sort of automatic. So I know lots of people who've had to sit by the bedside of their loved ones who are elderly, vulnerable, who the hospital want to put on DNARs, morphine, midazolam, and who are saying, no, they don't need it. They're fine. Leave them alone. And at that point, most practitioners will not overstep the mark and just do it regardless. So we've got to help people to kind of get in touch with their humanity again.
Absolutely. I think get courage is exactly right, and it's certainly evident that you've got plenty of that. Now, all the various things that we've spoken about will be in the notes for this interview, but for people who would like to follow up on what you're doing sort of day to day, where should people go to look for you, social media or anywhere else?
Yeah, so if you could put the links, but we're on Twitter, Telegram, Facebook, and we've got a Substack now. So all of those links are on our website, ukmedfreedom.org. And then we are completely sort of voluntary, and we do have overheads, so we do need donations. So if anyone, what we're hoping is like if 100 people could give us £5 a month, that would be really helpful, just to help us be able to kind of grow this, because there's so many issues on medical ethics. And if we've only got 2 or 3 of us, we're very limited in our resources to be able to tackle them all, because, we've got the assisted dying bill going on. We've got the stuff with stop the WHO. We've got this children's, healthcare decisions and the attack by the state on that. We've got the end of life protocols in the hospitals, which we haven't even had a chance to tackle yet, but is a massive issue. So there's so many sort of, big issues that we need to tackle. And we are the only sort of medical ethics organisation in the UK. So we're a bit overwhelmed at the moment, but if people could just support us, that'd be amazing. And, sign up to our Substack so you can get our, and sign up to our newsletter on the website. So you can just get our campaign updates, important news, calls to action, because we produce all this material, but we really want people to then use that material to go and educate their doctor, challenge their MP, whatever it is. We will have given you a good evidence-based argued, piece of material, but then what you do with it is what will have the bear the fruit.
Absolutely. The rallying cry. And of course, it is absolutely to everybody's benefit. So that's great. And as I say, all of that will be put in the notes for the interview, which is now drawing to a close. So thank you very much indeed for listening. And it just remains for me to say to Liz Evans, thank you very much indeed for joining me. It's been absolutely fantastic and fascinating voyage.
Thank you. Thanks for having me.